and really the background to the Specialist Dementia Care Program. Can you talk us through that?
Yes, thank you, Colm. So the background is in 2016, the government announced that they would implement the Specialist Dementia Care Program. It's a new government initiative to provide person-centred, multidisciplinary care to people with severe dementia who cannot be cared for adequately within a mainstream residential aged care setting. The commitment is to establish 35 units around Australia, one in each primary health network region. The program is designed to complement existing state and territory supports and services for people living with dementia. At the moment, we have one service which opened in September this year. That's the Brightwater service in Perth. We have another two services opening in Caulfield and Cardiff, which will be operated by HammondCare. And we have completed a competitive grants round in which we selected 7 services which will be operational within the first 6 months of next year, so progressively opening within the first 6 months of the year.
Now, this map gives us a little bit of a sense of where they'll be located. So can you talk us through that? Yes.
So as I've mentioned, we've already got one that's open in WA, in Perth. We have one opening in South Australia, two in northwestern Melbourne, one in Brisbane North, one in Brisbane South, one in northern Queensland and one in the ACT, as well as the Caulfield and Cardiff ones, which will be opening a bit earlier.
Okay. So really by the middle of next year, this first tranche of services will be online?
That's right, yes.
And so what can people expect from the Specialist Dementia Care Program?
So the program is intended to provide best practice care for people with severe dementia, and particularly people with severe behaviours as a result of their dementia. The care will be provided by multidisciplinary teams with significant expertise in providing care to people living with dementia. We're entering into a separate funding arrangement with the states and territories to secure specialist clinical support to provide additional clinical care for people within the Specialist Dementia Care Program. Each service will be run within a cottage-style environment that must meet the dementia design principles. Generally, the cottages will house 8 residents. There'll also be an additional bed to be available as a bounce-back bed, so that when people transition out of the program, if they need to transition back in for a little while, there's a place available for them. The program's focus, and I think this is, clearly probably the most important element, is to reduce and stabilise people's behaviours so that they're then able to transition into a lower care environment.
And so typically how long would you expect maybe somebody might stay in the program?
Our understanding, and I guess this is to be tested through the operation of the program, but our understanding is that we would normally expect a person to need the program for up to 12 months. But as I said, we'll see how that plays out during the course of the program.
And it's a multi-skilled team of staff, so nurses and allied health?
Nurses and allied health, and of course then we've got the psycho-geriatricians or the geriatricians coming in from the state sector who'll be providing that specialist clinical in-reach.